Country continues to deal with a rise in fentanyl overdoses. Officials here in Clark County are tackling the problem. According to the latest numbers from Nevada Drug Overdose Surveillance, emergency room visits from suspected overdoses have risen 20% in a month. From last year to this year, hospital visits are up by more than a third, increasing by 37%. And the health district says in 2022 alone, there were 549 drug overdose deaths. Doctors in the valley say there aren't many resources to help those fight addiction, and many can't afford it. Clark County plans to build an addiction rehab center meant for anyone and everyone who needs it. It will be paid for by money Nevada received in a recent multi-state settlement with 3 of the nation's largest opioid manufacturers. Fox 5's Jacqueline Schultz has more.
The biggest challenge that we run into is linking patients into services. Once they leave the clinic, it's like, where do we go?
The Huntridge Clinic's on the front lines of helping those battle addiction, offering medication to those hooked on opioids, fentanyl test strips, referrals to clinics and social services. Even they face enormous challenges finding places for those who want help.
We had a patient the other day that was currently homeless, tried to link into sober living. We worked all day. And the challenge for him was he didn't have an income. And then we discharged them back into the community that they came from with no resource.
Rob Phoenix of the Huntridge Clinic hopes this future project can help fill the badly needed gap. A massive rehabilitation center planned for Clark County that would be the first of its kind in Nevada. There's a plot of land north of Nellis Air Force Base and Las Vegas Boulevard. It would have a detox center, 30-day, 90-day, and 6-month addiction treatment services, and 240 beds. County officials say the cost would be around $150 million, but it will get paid for mostly by money coming in from opioid settlements. The county's getting $286 million through 2042.
Where the county is stepping into that space is because it's so needed. The fentanyl crisis fits into that conversation. Alcoholism, a lifelong issue.
County Manager Kevin Schiller explains those with addiction and mental health challenges need critical medical care and support for weeks or months to become stable and independent. They need follow-up visits for months or years to come. Private rehab centers are too expensive for most people. This public county center will accept private insurance and Medicaid. The design, Schiller says, is meant to be modern and welcoming, so you feel welcome to come back.
We're designing it with 2023 in mind.
Jacqueline Schultz, Fox 5 News, local Las Vegas.
And Schiller says some private and foundation funding will also help pay for it. It's estimated to take up to 3 years to build.